Hey, I'm Ashley. I'm a therapist. I remember a friend telling me this concept of like when we get to the end of our life, we imagine you're being shown two movies, and the one movie you're shown is like all the things you did do, and then the other movie is shown like all the things you didn't get to do. And our course of life is trying to like merge those two movies together so that we don't have regrets, that we like lived fully. And sometimes I think what happens is the numbing and the distracting and the avoiding of the discomfort or the intolerable experience or the pain provides this like temporary relief, which feels so good. And sometimes we need that temporary relief. But over time, if we do that, I think there's like a cost to that. We start to miss out on certain aspects of our life. And so bringing in like mindfulness or this awareness or this capacity to not necessarily go right to your distractions or right to your numbing or right to your avoidance right away, I think can lead to you living a little bit more of like the life that you hope for yourself. It's a challenge to like get out of bed, and it's like a challenge to brush your teeth. Um, and so I think in the same way we think about like anxiety is this big, like depression is this big thing, not necessarily like, yes, we could go like, okay, what's behind it, what's underneath it, we could, but that in itself could feel like you're digging even deeper. The perspective that life could get better feels really small. Like the perspective or the glimmer of hope in depression feels like it's like this small. And where maybe people without depression, their hope or their perspective feels like this, and it feels closer and they can see it. So we try to work on like, just even though the perspective feels this small, it's far away, we like slowly try to just focus on that like one little thing that we have, and then over time maybe it gets bigger.